Yolanda, 35 years old, came to the clinic because she had recently suffered an anxiety crisis, which, in her opinion, was a consequence of having been supporting too many things, among them 2 small children and a husband with anxiety problems. Such anxiety would manifest when driving, and was accompanied by a feeling of unreal vision with photophobia, which means that the light bothered her, and on the other hand, she had experienced dizziness, nausea, hot flushes, and fatigue, both physical and mental. She also felt accelerated and hyperactive. It is of paramount importance to always register the physical symptoms present in an anxiety condition, because our job is to be able to translate the patient's symptoms into an energetic language. In this case, the symptoms were accumulated in the upper part of the body, as if the energy was moving upwards: dizziness, nausea, and a feeling of suffocation, an ascent of energy upwards. Among the pathological antecedents, hypothyroidism stood out. I will simplify the process by explaining that for 12 sessions, I devoted myself to treating her junk food disorders, with mixed results. In session number 13, I changed the approach and needled just kidney 9, which is the creative point of Yin Wei Mai. I shall reproduce her words, which were spoken 10 days after that session. I feel so happy. Now I set limits. I don't feel guilty. I don't refrain myself from speaking, and I no longer have the mood swings I used to have all the time. Now I really feel much better. It's nice to see how she was explaining the array of feelings and behaviors related to a Yin Wei Mai disturbance, without knowing anything about acupuncture. Wouldn't you agree? I repeated kidney 9 stimulation. As her mood was good, I took the opportunity to treat other aspects on a physical level for 14 more sessions, and we concluded the treatment. My interpretation is that this active and sensitive woman, with a tendency to control, was excessively permeable to her environment. At a critical point, she suffered an anxiety crisis derived from a previous fragility of her Yin Wei Mai. Aurora, 45 years old, came to see me because of headaches she had been suffering from since she was 15 years old. These headaches manifested continuously. She felt as if her head was going to explode. The pain, predominantly in the Shaoyang area, was throbbing. It worsened with decubitus and local pressure, and subsided with local application of cold. Moreover, they were often accompanied by nausea. In addition to the headaches, Aurora had been suffering from allergic rhinitis, bilateral cervical pain, also along the Shaoyang path, as well as dorsal and lumbar pain for the past 10 years. She was the middle of 3 siblings. As a child, Aurora was very shy indeed. Her father was a violent man who was jealous of his offspring. Her mother, a manipulative woman, played the victim with them. After several attempts, the treatment that worked really well for her headaches was Sanjiao 5, the key point of Yang Wei Mai. However, the headaches did not disappear completely. In fact, they only resolved when I punctured kidney 9. A week after this session, she told me, "My mood has not changed sharply these days. I have been serene. Everything has been going around so smoothly." I repeated the kidney 9 stimulation, and a couple of sessions later, we concluded the treatment. This case illustrates how sometimes, even if the patient improves, but the symptoms do not subside, one has to wonder further what might be underneath. underpinning such imbalance? In this case, it seems clear that a yang wei tension was protecting a yin wei that was altered since childhood.